Stress, meaning, causes, symptoms, and management. Welcome to the Ultimate Wellbeing. Ultimate Wellbeing is a health and well-being channel. The Ultimate Wellbeing channel will help to improve your health and well-being. On this channel, you will see videos promoting good health and well-being that will assist you to improve your health and well-being to ensure your ultimate well-being. If you are new here, make sure to subscribe to our channel to get a regular dose of good health and well-being tips to become a better you for ultimate well-being. Relax, have fun as you see our videos and become a better you for your total well-being. Thank you. Stress, meaning, causes, symptoms and management are discussed in this video. Now, let us start. Meaning of stress. Stress is a process, not a diagnosis. We experience stress when there is an imbalance between the demands being made on us and our resources to cope with those demands. The level and extent of stress a person may feel depends a lot on their attitude to a particular situation. An event that may be extremely stressful for one person can be a mere hiccup in another person's life. You may feel under pressure to do something and fear you may fail. The more important the outcome, the more stressed you feel. You can feel stressed by external situations, too much work, children misbehaving, and by internal triggers, the way you think about external situations. Stress is not always a bad thing. Some people thrive on stress and even need it to get things done. When the term stress is used in a clinical sense, it refers to a situation that causes discomfort and distress for a person and can lead to other mental health problems, such as anxiety and depression. Stress may also contribute to physical illness such as cardiovascular disease. When stress turns into a serious illness, it is important to get professional help as soon as possible. Untreated anxiety disorders can lead to serious depression. Effects of stress. Stress affects us in many ways, including emotionally, including anxiety, depression, tension, and anger. The way we think, including poor concentration, forgetfulness, indecisiveness, apathy, and hopelessness. Behaviorally, including increased drinking and smoking, insomnia, accident proneness, weight problems, obsessive-compulsive behavior, nervousness, and gambling. Response to stress. Your attitude, personality and approach to life will influence how you respond to stress. Factors that impact stress on you include how you think about a problem, how anxious you feel generally, how severely the problem affects you, whether you have experienced anything like this before, whether you can control what is happening, how long the event affects you, how important the outcome is to you. The different ways a person copes with difficult situations. Your life experiences and life history. Your self-esteem. Whether you have people around who can provide support. Stress as a health problem. As a health problem, stress occurs when a person feels that the demands made on them exceed their ability to cope. Factors contributing to a person feeling stressed might include the environment, work, home, school, lifestyle, emotional and personal problems, and physical disorders. Stress and physical illness. When we feel under stress, our body kicks into high gear to deal with the threat. Our heartbeat, breathing rate and blood pressure all go up. The longer we feel stressed, the greater the demand on our body. The more often we are placed under stress, the more often we need the energy to cope. There is growing evidence that stress may contribute to physical illness such as cardiovascular disease, although this link remains controversial and research is ongoing, high blood pressure, proneness to infection and chronic fatigue. Whatever the cause, physical diseases need appropriate medical management before any attempt is made at stress management. Discuss with your doctor how stress management may be used to support the treatment of your physical symptoms. Stress and anxiety. Untreated stress can turn into a mental illness such as an anxiety disorder or depression. Almost everyone experiences some anxiety. This is normal. However, An anxiety disorder is different from everyday anxiety. It is more severe, can persist and may interfere with a person's daily life. Common anxiety disorders include generalized anxiety disorder. The person is constantly worried, often about irrational things, and cannot be reassured. Panic disorder. Specific phobias, such as fear of flying or of spiders. Agoraphobia, fear of public places or of being away from home, and social anxiety disorder, fear of the scrutiny and judgment of others. A less common anxiety disorder is an acute stress disorder. Anxiety is a very treatable condition. There are many different psychological and medication options. Treatments need to be individually decided on and regularly reviewed to make sure they are effective and to minimize the side effects of medications. Separately and in combination, psychotherapy and medication therapy generally produce good results. Untreated anxiety disorders and depression. Untreated anxiety disorders can lead to serious depression. Depression is about twice as common in women as in men. The most common time in life for people to suffer from depression is in their 40s. However, it can develop at any age. Depression is often associated with an increased incidence of suicide. The annual suicide rate for people with depression is 3 or 4 times higher than that of other psychiatric disorders. Stress at work. Stress in the workplace is common and is caused by many different factors, including excessive hours, conflicts with others and feelings of isolation. The amount of stress a person experiences is often determined by whether they can accept that some things in life will simply never be sorted out to their satisfaction. For example, a person may feel stressed by the way they are treated by their employer or by the behavior of a work colleague. Sometimes, this stress can be resolved by dealing with the behavior. In many organizations, there are processes to deal with workplace problems like harassment, victimization, or unfair treatment. In many cases, the problem can be resolved if the behavior is changed. However, some problems will never be fully resolved, and you may have to accept them. For example, if someone who you think is poorly qualified is given a job you felt entitled to, you may continue to feel stressed unless you are able to let go of that grievance and move on. Stress management. The old saying prevention is better than cure is certainly true for stress management. It will help if you exercise regularly. Regular exercise is a great way to manage stress. You should do some form of exercise that causes you to feel puffed afterwards. A leisurely stroll to the bus stop is not enough. Have at least 20 minutes of exercise 3 times a week. Avoid conflict. Avoid situations that make you feel stressed, such as unnecessary arguments and conflict, although ignoring a problem is not always the best way to reduce stress. Assertiveness is fine, but becoming distressed is not. Relax. Give yourself some time to relax each day and try to spend time with people who make you feel good about yourself. Eat well. A nutritious diet is important. Eat plenty of fresh fruit and vegetables and avoid sweet and fatty foods. Sleep. A good sleep routine is essential. If you have difficulty falling asleep, do something calm and relaxing before you go to bed, like listening to music or reading. Enjoy your life. It is important to make time to have some fun and to get a balance in your life. To deal with stress more effectively, it helps to investigate your stresses and how you react to them. Try to understand what situations make you feel stressed. Understand what situations you can and cannot control. Prepare for stressful events in advance, by thinking about the future. Keep yourself healthy with good nutrition, exercise, and regular relaxation. Try to do happy things every day. Getting help for stress. You should see your doctor or community health center if you feel stressed often. Particular things stress you and you feel they are beyond your control. You feel your reactions to stress are extreme or worry you, and you feel anxious or depressed about stress. Conclusion. Stress, meaning, causes, symptoms and management have been discussed in this video. We experience stress when we feel under pressure to do something. Stress is a common reaction, however, when it becomes constant it can turn into a problem. A balanced lifestyle and coping strategies can help you manage stress. Issues that cause stress cannot always be resolved, but changing your expectations of a problem may help. Untreated stress can lead to serious illness. It is important to get help if you feel you cannot cope. Hope this video is useful and beneficial to you. We love to hear from you. Please post your comment below in the comments section. If you are new here, make sure to subscribe to our channel and press the notification button so you can get a regular dose of good health and well-being tips to become a better you for your ultimate well-being. If this video has been helpful and beneficial to you, then give it a thumbs up, share it with your friends and leave a comment below. Kindly note that any information on this video is provided for educational purposes only. Diagnosis and treatment decisions should be made in consultation with your doctor. Thank you. Thank you for seeing the Ultimate Wellbeing videos.